Good evening, everyone, and welcome to our session today in the Prescribing Positivity series on A.M.E TV. This is where we discuss various health topics. We share expertise and resources with our congregations and communities across Zion. My name is Dr. Yabo Beysolow. I serve as the director of the health ministry of the A.M.E Zion Church, and I'm so pleased to be here with you this evening, and we want to welcome you to the discussion. Back in February of 2025, the health ministry of the A.M.E Zion Church, under the leadership of Bishop George D. Crenshaw, who is our presiding prelate of the North Eastern Episcopal District of the A.M.E Zion denomination, and also the chair of the health committee of the Board of Bishops, and myself, we signed a memorandum of understanding, an MOU, with the American Diabetes Association. This is a groundbreaking collaboration between the health ministry of the A.M.E Zion Church and the American Diabetes Association. It's so important because 38.4 million people have diabetes in the U.S., those who are diagnosed and undiagnosed. That's about 11% of the population. So 1 in 10 Americans has diabetes. Majority of that is type 2. Type 2 diabetes can be prevented or delayed with lifestyle changes. And so the American Diabetes Association is committed to finding a cure for diabetes and ending this disease. The health ministry of the A.M.E Zion Church, we are committed to increasing awareness about health conditions that impact our communities, committed to increasing health literacy and self-advocacy and decreasing health disparities. So this collaboration marks really a significant step towards ending diabetes and preventing the migration from pre-diabetes to diabetes in our communities. So I want to bring on our esteemed guest for this evening, who we'll be talking to. And the first is Bishop George D. Crenshaw. Bishop Crenshaw is no stranger to you. We are honored to have him join us this evening. Good evening, Bishop Crenshaw.
Good evening, Dr. Yabo.
Bishop Crenshaw was elevated to the episcopacy from Shaw Temple A.M.E Zion Church back in 2016 as the 103rd bishop in succession. Since then, Bishop Crenshaw and missionary supervisor Lorena Crenshaw have led Episcopal districts around the globe with a spirit of evangelism. They've been birthing churches and conferences around the globe. He also serves as the chair of the health committee of the Board of Bishops of the A.M.E Zion denomination, and he's passionate about improving the health of our denomination. He's had several accolades, including serving as president of the Sherrard branch of the NAACP. He's a past board member of the Chesterfield General Hospital, also in Sherrard, South Carolina. He holds an honorary doctorate degree from both Clinton College and Livingstone College, and a Master's of Divinity from Hood Theological Seminary. Bishop Crenshaw has exercised his dominant spiritual gifts of administration, teaching, shepherding, and preaching to fashion a ministry that's designed to both empower and to edify. So welcome again, Bishop Crenshaw.
Thank you so much.
You're welcome. You're welcome. Next, we would like to bring to the stage Terri Wiggins. Good evening, Terri.
Hello, Dr. Beysolow.
So nice to have you on. It's a pleasure. Terri is a purpose-driven leader. Her career reflects a very deep commitment to serving others and to bring lasting change to communities in need. She's currently serving as the Senior Vice President of Health Access and Quality at the American Diabetes Association, where she's leading national efforts to expand access to care, to improve health literacy, to uplift individuals and families impacted by chronic conditions. And her work is especially urgent as we see more than 130 million Americans living with either diabetes or prediabetes, and over 40% of adults in the US struggling with obesity. All of these are conditions that place a significant burden on our communities. And Terri is dedicated to ensuring that everyone, regardless of their background, their zip code, have the opportunity to live healthier, fuller lives. She works closely with faith-based organizations such as ours, advocacy groups, civic partners, to develop those community-centered solutions. And before joining the ADA, she's held various leadership roles at the Urban League of Philadelphia, the American Heart Association, and other reputable corporations and holds a master's in information systems from Drexel University. So without much further ado, we are going to start off our discussion and the significance of this MOU. And we'll start first with Bishop Crenshaw. Bishop Crenshaw, why is this topic of diabetes so important in our churches and in our communities?
Dr. Yabo, it's important because it's a biblical mandate. 3 Jude, only one chapter, but the second verse says, "Beloved, above all things, I wish that you prosper and be in health, even as your soul prospers." So the A.M.E. Church has made the commitment to not only seek to help persons be prepared for the afterlife, but to make sure that they can enjoy this life in good health. We know that diabetes ravages the African American community, which then means it affects greatly the African American church. So everything that we can do to help alleviate this chronic condition, the A.M.E. Church is committed.
Thank you. And you could not have said it better. Just how it continues to ravage diabetes, that is our congregations, our communities. And the fact that, blood sugar, when we think about it, people think it's, okay, it's just sugar in the blood, but it can really damage our bodies, leading to heart disease, loss of vision, kidney disease, etc. And so, Terri, we're going to talk to you for a little bit now tell us more about the American Diabetes Association. Many of us may not have heard about it. Tell us a little bit more about the organization and what you do.
Thank you. And before I do that, I would like to thank Bishop Crenshaw, one, for his leadership, for making a commitment on behalf of the entire organization to ensure that everyone gets the information. You spoke about health literacy a couple of times, making sure that all the congregants get information to keep them healthy and well. I am extremely excited that he recognizes as a leader that it's all of our responsibilities to be good stewards over our bodies. And so I just appreciate the collaboration with the American Diabetes Association through the MOU. It's contractual-ish, but that's not why we did it. We did it because you have a system, and I say that because you have so many members that are part of A.M.E. Zion Church. So the more people that we can reach, we believe that we'll get some good health outcomes, and that's the ultimate goal. So I just wanted to start by saying thank you. So you both really used a lot of what I was going to share as far as statistics and data and information. As my team and I go into different communities across the U.S., one of the number one things that we hear from people is, "I just didn't know." Right? We're not necessarily always in tune with our bodies and why our bodies respond and act certain ways. And so when you think about diabetes, and you talked about this, Dr. Beysolow, early on, about prediabetes and diabetes, it is ravaging our communities. The prevalence rates are the highest in the world. And when you think about obesity, and we often don't talk about it, obesity is actually a chronic disease, similar to diabetes. Prior to coming to American Diabetes Association, I did work at American Heart Association, leading their vascular health area. And it helped me to learn how everything is connected. And so when you think about some of these chronic diseases, they typically don't sit alone or by themselves. And so one of the reasons why this collaboration, this relationship, the strategic alliance is so important is because I believe that just with information, people may make different decisions. We've all heard that we should eat better, we should exercise, but for many, you say, well, you should exercise. They say, well, I don't even have sidewalks in my community. Where in the world am I supposed to walk to? Or you should eat better, eat more fruits and vegetables. Well, how in the world am I supposed to do that? Like, I live in a food desert. There is no fresh produce in my community. And so these are some of the things that we are focused on as an organization, that I'm focused on as a professional, and that I'm excited to focus on alongside of you.
Wonderful, wonderful. I mean, thank you for just acknowledging the significance of this collaboration. And again, we thank Bishop Crenshaw and the Board of Bishops for highlighting this, along with many issues that plague our communities. And you talked a little bit about diabetes and prediabetes. In the U.S., we know that about 1 in 3 adults has prediabetes. Many of us are struggling with it and trying to get that A1C down to that acceptable level. Sometimes we skip those appointments because we're trying to wait a couple more months to get that level down before our doctor sees us, and we don't get, a pat on the hand. But it's so important. But a lot of people don't even realize that they are in that pre-diabetic stage. So could you share with us a little bit about how we can tell that we're in there and what resources that you may offer?
So one of the things that I like to always encourage people to do is just to get regular checkups. Sometimes things are basic. And so for those that may say, well, I don't have health insurance, I don't, we like to partner with clinical settings, right? So not everything has to be through a traditional healthcare system. But it is very, very important to at least get a checkup once a year. I know that's very difficult, specifically for sometimes African-American males. And there is research and statistics that show that they don't always go get their checkups. And a lot of these conditions that we're talking about are fairly progressive. And so you're right. A lot of times you may be experiencing different symptomatic things. And again, it goes back to health literacy. You're just not clear or unsure of what that means. I think the best advice that I could give is to definitely seek a healthcare professional. But if you don't have the resources, namely insurance, there are other methods to allow you to be able to see someone. We have a lot of relationships that we're developing with organizations that focus on community health workers, because after COVID, we found that many people don't necessarily have a primary care physician or someone that they see regularly, but they do sometimes see a home health person regularly. They do sometimes see, if you're going through maternal and fetal situation, you may see a doula or a midwife. You may have a social worker that you see, or, just other professionals that you rely on, that you trust. Pharmacists, in some of our rural communities, many people rely on their pharmacists as their trusted voice for healthcare information. And so the education piece goes beyond just the person. Also, our health professionals or those trusted voices. But I think the number one thing that I could say is always, every year, whether you feel good or not, have someone understand how you're feeling, what you're going through, primarily a healthcare professional, clinical professional preferred, but even some of your non-clinical professionals who are aligned to your health systems can help you in that way also. I would also speak to advocacy. When we think about policy change, for many who don't have access to healthy food, let's say, or like I mentioned, the sidewalks, or health insurance, or they may not be able to afford insulin. That was a big deal for quite a while. And I know that the political landscape is changing. However, that's why I like to emphasize the importance of us working together as a system, because I think there's a collective impact to make a difference in change. But when you have advocacy tied into this type of community-centric work, together we can make a change. We can break down those barriers that are preventing people from their optimal health and wellness.
Excellent, excellent. You shared some very valuable information. It was a great segue into a question now that I have for Bishop Crenshaw. You talked about those trusted voices. So Bishop Crenshaw, when you envision the denomination and how pastors and leaders can become involved, what are your thoughts on that in this fight against diabetes?
I think the Board of Bishops made an outstanding decision just a couple of years ago when we decided that we needed one person who would help us to lead our health ministry. One person whose voice that every bishop would have access to, that every Episcopal area will be able to call, and receive information from the most qualified person that we felt within our denomination. So we're happy, we're now excited that regular information concerning the entire health of a person is now at the forefront for us as a denomination. The bishops made the decision that we're not just going to prepare people for heaven, we're going to prepare people to live healthy here on earth.
Mm-hmm. Amen. Amen. And I'm sure that's the message that you're hoping the pastors also, in the local congregations will share with their members, the health message.
Absolutely. And at annual conferences, that is what we're saying to all of our pastors, that we have access now to persons who can help us individually as a conference or individually as a local church. And each of them know that they have access to qualified information.
I think that's pretty important. I think if I may, some of the community health workers that we talk about, they're part of health ministries in local bodies of believers. And the conference piece is especially important as well. I agree that the leadership recognizing that spirituality and health, they're connected, right? It's not separate. And I really like getting ahead of looking up at the conference and not seeing brother so-and-so or sister so-and-so, and people start, it's like, well, where are they? Where are they? They're sick or they've gone on. And so let's get ahead of that, right? We can be preemptive in how we address our health and our wellness. So when we come to our conferences, when we are congregating and worshiping, we're all in good health. We're all in good spirits.
Excellent. Excellent. The first way we can do that, just as you said, is just with awareness. So, I know you have a risk test that you all are promoting. Is that something you could share with us? Because we really want our pastors and our leaders to share this with their congregations as well.
Mm-hmm. And so the risk test it takes 60 seconds, and I love it. And it's embedded within our MOU that we will continue to push this out to as many members as possible, because for some, they may not even know that they're at risk for diabetes. We have one for obesity, and we also have one for diabetic eye disease, because people don't know the number one cause of blindness is diabetes. And so again, it's a systems approach or whole body approach, like Bishop Crenshaw said. Everything's connected. And so we got to get ahead of some of these chronic conditions. So I would like to share really quickly, if you don't mind.
Sure. Just
so that people are able to see what you're referring to. Are you able to see my screen?
Not as yet, but it's coming up, and we'll fix this in the recording, in the editing. So we're good.
Let me know when you can see this.
Yes, we can see it now.
Perfect. And so this resource is actually on our national website, but we've also created a custom URL or a custom QR code that we are going to put on all the literature that we use for A.M.E. Zion churches, so that you, as you are having conferences, health fairs, it will be on some of your collateral and your material, so that people can pull out their phones, they can scan the QR code, and within 60 seconds, there's an algorithm that is evidence-based that will let them know if they are at risk of diabetes. And so I think that is important for people to understand. Hopefully this other screen is coming up, because this primarily is a risk test for type 2 diabetes. I do want to call that out. And if you're able to see my screen, you'll see that you're able to take it for yourself, or you're able to, if you have someone, your caregiver, let's say, you're able to access this link to help you walk through for someone that you care about and that you love. You can also see right now, we have it in English and Spanish, and we hope to build on different languages and potentially different dialects to make it more accessible for people to access and to see.
Excellent, excellent. Love this 60-second risk test. And I tried it out myself before tonight's session. It really does take a little under a minute or so, and it gives you some very good insight into where you are health-wise and whether you need to see the physician or not. And you mentioned something, um, at our conferences, and what we're hoping to do, especially starting this summer, is pair that with actual screening. So we have some vendors. So for example, in July, we have our Connectional Lay Council Convention. And in addition to this risk test, we'll also have a mobile screening van that'll be there from a local health entity. And I know one of your representatives from ADA will be there as well. And we're going to actually have free blood glucose screenings, because it's so important that people know their numbers. And that's one thing, hopefully, that we can all take away from this conversation. Know your numbers, know your glucose levels, your A1C levels, your blood pressure numbers, because as we mentioned, everything's so interconnected. So I wanted to, again, just turn back to both of you for any closing nuggets, any pearls that you wanted to share with those who are listening tonight, Bishop Crenshaw.
One of my favorite movies is The Ten Commandments, and it comes on now. It used to come on Easter night. Now it comes on the night before Easter. There's a statement from Moses when he's sitting there talking about the tally of bricks with his brother and with Pharaoh. He says this. He says, well slaves make many bricks. Sick slaves make few bricks. Dead slaves make none. We got to make sure that we prioritize the health of our membership. Singing is good, shouting is wonderful. But if we fail to prioritize the health of those who attend our churches, we have not been as faithful to them as they have been to us.
Wow. That was powerful. That was powerful.
Very.
I think, that's a hard act to follow. I wish I had gone first and let Bishop Crenshaw go last, because I don't know how to. That was powerful. Thank you for sharing that. That hit different. I would say that the American Diabetes Association is a patient advocacy organization. That is why we exist. That is what we're here for. So we focus on research. We focus on providing resources and tools to help inform. We focus on advocating for policy change to remove barriers to health and wellness. But the thing that I think is most impactful is connecting with people. And that's what this collaboration is going to be all about. I am beyond excited. Not only is it about giving out information, educating, raising awareness, but it's also understanding from your membership. If they're not managing their health, why not? If they're not able to get access to care, why not? If they have access to care but don't understand what they're being told, how can we help? If there are barriers, social barriers, that are preventing people from being healthy, because we don't talk about it often. Again, we say, exercise more, eat better, do this, do that. And sometimes there's underlying reasons why people can't do any of those things. So how can we help? And so for me, connecting to a beautiful system like A.M.E. Zion will allow us to hear from you. And then you can partner with the ADA to help us build out and develop whatever the resources are that are going to meet the needs of your membership. And so I'm excited about it. I'm grateful for the opportunity. I'm thankful to know each of you. And this is the beginning of something wonderful. So I appreciate the time today.
And so are we. Just thank you. Thank you so much. We are excited for this collaboration that we know will be life-changing and will truly help our congregations and our communities through awareness, through education, through increasing self-advocacy and health literacy. So we are thrilled. We want to thank all of you who have been tuning in with us this evening. As you can see, scrolling across your screen now are links to the different resources that we have shared this evening for the American Diabetes Association, as well as for the risk tests. So you'll have all of that at your disposal, all of the links and resources. And we also want you to stay tuned for upcoming interviews in 2025. You can look at previous recordings on A.M.E TV on the Prescribing Positivity channel, going back to over a year ago, where you can see recordings from discussions with heart specialists, with nutritionists, etc., building that holistic health picture. And that's what we really want you to take away from this, is how we can heal both the mind, body, and the spirit. And we also want to thank our hosts for this evening, Brother Darren Kent and Sister Ayana, for their help in producing this program this evening. And thank you again for all of you. Goodbye.
Thank you.